This is Cadillac Unscripted on 107.9 CDY. It's sponsored by Independent Bank as well as Marianne Quist of Remax Central. And we're going to spend the next little while with some local chat here. And we have with us this morning Kathy Jacobsen. Kathy is the Senior Coordinator for Community Health Education for Munson Healthcare's East Region, which I don't know how you fit that on a business card, Kathy, but it's all there. Good morning. How are you?
Good morning. Thanks, Rich. Just very small font. That's how we get it on there.
That's probably true. Well, the reason why we had you on is I learned recently about something new that is coming to a several county area in the listening area that involves, I guess, learning about healthy ways to prepare foods, healthy ways to live, healthier ways to live. And there's a little carrot, maybe literally and figuratively, at the end. So why don't we talk about this program? First of all, Kathy, what is it called?
The program is called the Fruit and Vegetable Prescription Program. That's the original name. It was piloted first in Washtenaw County, but we're calling it something a little different. We call it Prescription for Health. And you kind of touched on what it's about. We do have some literal carrots in there as prizes if people attend the classes. And it's for a lot of counties in your listening area. So we've got Manistee, Missaukee, Wexford counties, and also Crawford. And any resident of these counties are eligible. There is no income level. There is no reason not to join. We can have multiple family members even join. And you can get up to $100 in fresh fruits and vegetables, also frozen or canned, because, now with the pandemic, we're not able to meet at the farmer's market for these classes that we once did, and we're meeting all virtually. So you get to meet people from a lot of counties, so there's a lot to enjoy there. And there's just lots of different sessions coming up that we'd love your listeners to call in to, not your station, but we will give my contact information, and they would be able to join these classes. The next ones start in December 1st, actually. And
how many sessions are there, Kathy?
Well, right now we have 4 scheduled. So December 1st to January 12th, which would go into the new year. And we have My Way to Wellness. That's going to be every Tuesday at 9 a.m., and that's more of a self-paced cohort that meets via Zoom. They all meet via Zoom, but this is kind of more of a self-paced one. That's really the first one we've done of that. We're going to see if we have people that are interested in doing that. And then we have more of a classroom atmosphere where you get to meet people from the different counties and enjoy the different classes. All these, I'll let you know when they are, but I want to mention the MSU Extension and their nutritionists are the ones that are teaching these classes. So the next one after that would be January 11th through February 15th. That's called Cooking for One. And a lot of times people, empty nesters, keep on making those meals for 6 people, and this kind of pares it down. You save a little bit of money, and you actually add some nutrition in there, too, that maybe you didn't know about before. And that meets January 11th through the February 15th, Thursdays at 1 p.m. And then we have on another Cooking for One class, January 26th through March 1st, and that meets every Tuesday from 7 to 8 p.m. We're trying to get lots of times in there that accommodate all different types of schedules. We did have a lot of requests for evening classes, so we're trying to make that happen this next session. And then the last one that we have scheduled, but it won't be the last, just the last one we actually have scheduled, is February 10th through March 10th. And that's Eat Healthy, Be Active. That has a little bit of more incorporation of some exercise in there, and that meets every Wednesday starting February 10th at 7 p.m. And that's what we have scheduled for now, Rich, but we're looking to keep scheduling out well into the early summer and fall.
So I heard you mention self-paced. Now, self-paced means not live, correct?
That's correct.
Okay.
I think that, they will have some modules for people to complete, and then just kind of hand that in. They'll always have someone on call for them to ask any questions, resource people available. Sometimes people just can't fit that, that class time into their schedule. They like to do it more at a self-paced situation.
Well, we live in an on-demand society, so it's sometimes people are just looking to do things at on their own pace and on their own time. So that does make sense. How many of these do you expect to be? Is the first one that you mentioned is self-paced, but the rest of these are going to be live in real time, right?
That's correct.
Okay.
Yep.
Okay. And how many sessions do folks have to attend in order to get the prize, to get the reward at the end?
Yeah, that's a great question. 5 to 6.
Okay.
Yeah, the average is about 6 or 5. It just depends on if we have, if there's just different factors. But 5 to 6, and then if they fill out a post class evaluation, because we always want to know what people would like us to improve or what they like and they like us to keep, then they will get extra funds for that. But everything's up to the $100, and I love sending out those vouchers. I'm telling you, I'm letting your listeners know that's what my favorite part of my job is, loading all those vouchers in an envelope and sending them off.
So
it's been real nice.
Well, and I guess my next question is where does the money come from to make those vouchers and that reward possible at the end of this?
Well, the Munson Healthcare and District Health Department 10, with MSU Extension, we're all kind of joint efforts for this program. But DHD 10 and Munson Healthcare wrote a grant for that, so that's where those funds come from, and that grant will most likely expire. We should have our funds by the end of the November. Yeah, so we want to get these classes in so we can get the vouchers to people that could use fresh fruits and vegetables.
And the thought is to get this, you'd ultimately like to have all these classes done by springtime 2021?
No, by November. Sorry, the fall of next
November
year.
2021.
Yep.
I gotcha. Okay.
Yep, sorry.
No problem. So the next thing is, people are hearing this. They might want to sign up. Where do they go to A, learn more about it, and B, sign up?
Well, they can go to, they can email us directly.
Okay.
Or a phone number. So what do you think your listeners would prefer, or just kind of say both of those?
Let's just give them both. As many opportunities as we can.
Okay, so for residents of Manistee, Missaukee, and Westford County, you can call my counterpart, Stephanie Williams. Her phone number is 231-352-2976. I'll repeat that. It's 231-352-2976. Or if you're savvy with email, go ahead and email her at swilliams. So it's SWILLIAMS 4, as in the number 4, at MHC, as in MunsonHealthcare.net. So it's swilliams4 at MHC.net. Or if you'd like to talk to me and you live in Crawford County, you can call me at 231-437-3481. I'll repeat that, 231-437-3481. Please leave a message on both of our lines. And then, or you can email me at kjacobsen, KJACOBSEN. My husband is from Norway, so we're SEN at MHC.net.
This is a really fascinating program. Has this been done in this regional area before? Is this a repeat program?
No, it actually has. It was implemented first in Traverse City in 2015, and that was through a grant through the Michigan Department of Health and Human Services. And now Munson has decided that it did so well that we want to expand it to other areas of our service area. Okay. And give us the county list again for those who are interested, where this is available. Yep. Manistee County residents, Missaukee and Wexford, and Crawford County. So those 4 counties is where the grant is being awarded this time around. We'd love to get it everywhere, but we're working our way through there. And we've had really great results from people that have really increased their fruit and vegetable consumption, have just lost weight by bringing in the good stuff, and it naturally crowds out the stuff that maybe isn't so healthy for us. And actually, during this time of the pandemic, when people are isolated at home, they've actually, had more contact with other people with similar goals. So it's been real special that way too. So there has been a few good things that have happened through the pandemic. We've been able to work with my partner in the South region, Stephanie, and just combine all our counties together to work towards health.
And that's the whole idea, right? The idea is to get people to eat better.
That's right. We want to keep people out of the hospital. I've been a nurse for almost 30 years, and believe it or not, we like people to be well. So if we can keep you out of the hospital, that's good. People are always going to end up, there's something that might arise, or you need an elective surgery. But for the most part, we want to see you on the street, out shopping. We don't, not necessarily right now, but see you waving to you outside of the hospital, not inside.
All right, so let's circle back here and get the contact information on the air one more time before we wrap up, Kathy,
sure.
for this program.
Sure. So for residents of Manistee, Missaukee, and Wexford counties, please call Stephanie Williams, leave a message, and her phone number is 231-352-2976, or send an email to Stephanie Williams, and I will say her email address is Williams, SWILLIAMS 4, it's in the number 4, at M. If you're part of the Crawford County, you can call me at 231-437-3481, or email me at kjacobsen@mhc.net. We'd love to hear you, and if you email the wrong person, don't worry about it. We'll work hand in hand together, and we'll get you to the right person.
And it does sound like there is a lot of interagency cooperation going on in this program.
Yes, definitely. There really is. We've been able to streamline a lot of the flyers and just like a lot of the messaging out to people, just to get everyone involved, not working in individual silos. So that has been a real rewarding experience.
First class begins when, Kathy?
It begins December 1st. We have classes going now, but they're kind of already started. But the first one is that December 1st to January 12th. That's that self-paced one. If you're looking for a little cooking for one class, and you get lots of healthy tips, and you can actually, share, and it can be cooking for two as well. January 11th through February 15th, and that's on Thursdays at 1 p.m. Another cooking for one, if you missed out on that one, it starts January 26th through March 1st, and that'll be Tuesdays, 7 to 8 p.m. And then Eat Healthy, Be Active will be on Wednesdays starting February 10th to March 10th. And like I said, we'll be doing stuff beyond that. So if all those dates don't work out for you, stay tuned. Don't throw away our phone numbers. We're still doing it all the way till the fall.
That is Kathy Jacobsen, Senior Coordinator for Community Health Education from Munson Healthcare East Region, sharing with us a way that you can make yourself a little healthier and maybe get yourself a nice little reward at the end of these classes. Kathy, thank you very much for your time today.
$100 worth of reward, Rich. Yep, thank you so much. Been great talking to you this morning. Have a great day.
We appreciate your time, Kathy. More coming up here on Cadillac Unscripted 107.9 CDY. Buying a home is still the great American dream. And yes, it can be an intimidating process. But you can rest assured and have confidence when the professionals from RE/MAX Central are in your corner to guide you through it. Mary Ann Quist of RE/MAX Central has helped hundreds of home buyers in and around the Cadillac area navigate the process over the years, and she's ready to help you too. From start to finish, from finding a home to submitting an offer, to understanding the purchase agreement, to inspections, surveys, and appraisals, to the time when you finally sit down and sign those closing documents, Mary Ann will be there. When you're ready to buy, talk to Mary Ann Quist at RE/MAX Central. See her listings at teamquist.com. It's part 2 of Cadillac Unscripted on 107.9 CDY. Cadillac Unscripted is sponsored by Mary Ann Quist of RE/MAX Central and Independent Bank. I am Rich Spicer, and I am pinch hitting for Katie Huckle, who is out of town this week. And we are very, very happy to welcome Amber Herlein, who is the Executive Director of Oasis Family Resource Center. Hello, Amber. Amber, how are you?
I'm well. How are you?
Doing great. I know the agency is doing a lot of wonderful things as we get close to the holidays here, and we wanted to have you on to talk about a few of those holiday-related things, and then we'll go from there. So first of all, let's talk about Thanksgiving and what the agency is trying to do for some folks that you're trying to help.
Absolutely. Thank you so much for having us on. I mean, as always, we show up every day and we think, our work is so powerful, and it is so meaningful when others in the community think that too. So we appreciate you taking the time to do this.
Absolutely.
So Thanksgiving, if you're someone who doesn't really not sure about the holidays or not a big deal, if you came in our offices around the holidays, I think it would change your heart a little bit. It's such a moving time. So with Thanksgiving, we really reach out, all the staff of Oasis reach out to the families that they're working with, that they've, built relationships with and really gotten to know well and are supporting them just to see the need. And then we are able to get community support and sponsors through lots of different ways. Some buy the food or the sides, or some commit to turkeys. And we provide that family according to the size a Thanksgiving meal, or the community does. The staff really work hard to make sure that is a need. We serve a lot of families, and so we really make sure the ask is something tangible that the community can really wrap around. And this year, our ask has doubled. We were a little bit surprised. We figured it would be a little bit higher this year, but we didn't really know. And when the staff hit the ground running, really kind of diving in with families, our ask doubled. Typically, we have about 30 to 35 families, and we're currently at 60. And we always get some families, like that come in at the last minute that we just start working with that have needs too. So we know that will probably go up a little bit. So that was, on one hand, I'm so thankful that the community does this and supports it. But man, to know that ask doubled this year was concerning and troubling, right?
Yeah. You have had some businesses already step up and help make this happen for you, haven't you?
Absolutely. So AAR every year, so I've been there 4 years, AAR is always our go-to, and they, the staff there actually donate their turkeys. So I think, if I understand it right, they get a gift from AAR, from the company, and then staff in turn, instead of taking them at home, some of them donate them back to Oasis.
Wonderful.
So that's amazing. They do that every year for us, and they do a big bulk of the turkeys for us. 44 North has traditionally, since again I've been there, really done a huge bulk of our side dishes for us. And Wolverine also has joined that, and they're doing desserts this year, and they have done that for a few years in a row. So those are big. Baird, Cotter, and Bishop came in with a big donation of turkeys today. So there's lots of businesses joining and lots of individuals. So at this point, our turkeys, I said that to my staff when we found out what the ask was, like how many families needed it, and it was a little bit overwhelming. And I just said, there's no problem. You ask tangibly, and this community will show up for something like this. And they have. We can't even get Facebook posts out fast enough to update people, it seems like, because we're constantly just getting called, which is so amazing. But our turkey needs have all been met, and I'm actually driving home with a load to go to my freezer until Thanksgiving because they need to go somewhere.
So this year, in a year when you doubled the amount that you needed from last year, the community stepped up.
Yeah, 100%. I mean, we're met on turkeys. We still need all the sides to go with that, which I have no concern about. No one's committed to a certain amount of those yet. But I even know if the need was bigger, you ask, and these people show up. They believe in what we do. They believe in supporting these families that we work with. It's an easy ask for people. They want to support our work and what we do because they know how vital it is, and they want to join that mission, and they have shown up big.
So in regards to Thanksgiving coming up here in less than a couple of weeks, what do you said you're set for turkeys? What do you need? What could you use help with?
So the sides specifically we're looking for are instant mashed potatoes, like canned or jarred gravy, canned yams, canned cranberry sauce, like cream of mushroom soup and the onions and the canned green beans for green bean casserole, and roaster, like disposable roaster pans for the turkeys. The desserts are also taken care of, but those main sides are the ones that we're looking for. And then we distribute. So if a family is much larger, which we see that's been a change kind of since COVID. We've seen some really big families come forward with, 4 kids. We give according to that size. So they might not get one little package of instant potatoes. They would get enough that their family can enjoy a feast together.
What a wonderful community we live in.
Absolutely, 100%.
So let's talk about what you're doing between Thanksgiving and Christmas. So you've got a program that you've got going on where you're asking folks to essentially adopt a family. Can you fill us in on that?
Absolutely. So these two are running a little bit simultaneously right now. It's a little crazy for us, but totally worth it. So the staff has been working for a little bit now, again, really connecting with the families that they're working with, individuals and families, to just really talk to them about Christmas and the holidays. And they really spend a lot of time saying, what are your needs and what are your wants? And they sit there with them and really, really talk through that. And so then we turn it in, and it seems like it might be far ahead, but really people are starting to shop now. It seems like they start calling around November 1st saying, I want to adopt a family. Can you sign me up with one? So we're already connecting individuals, families in the community, businesses with a family that they can sponsor this Christmas.
Okay.
So, yeah.
So going back to the Thanksgiving sides and the adopting a family at Christmas, how do folks do that? Who do they get a hold of? How does that process work? Yes.
Please call our administration office at 231-775-7299. And then that way we can connect and we can decide at that point. We can email you. We give the sponsors, specifically for the Christmas ones, we give the sponsors a very detailed list of some of the needs and wants and sizes and preferences and all of those details, so that at that point, our point person, ENG, can decide which way is best to communicate with you going forward.
So let's circle back now and talk about the mission of Oasis Family Resource Center. For those who aren't aware of the agency and the work that they do, can you give me the thumbnail sketch in about 3 minutes of what Oasis does?
Absolutely. So we service survivors of domestic violence, sexual assault, and we also have a parenting program that supports families and parents as they, can parent in some really difficult circumstances. So within that, we have a ton of services. We have an emergency shelter, a 16-bed emergency shelter. We provide counseling. We provide groups. We provide advocacy, all the way from personal protection orders to helping them find employment and stable housing, really anything that they need to get reestablished after ending a violent relationship. We also help them safety plan to keep them safe. We empower them. We see the value in them, and we want them to know how valuable they are. And so a lot of our work is also just kind of helping them unravel all the lies that they believe about themselves and help finding all the amazing, incredible things about themselves. So my staff work hard to do that in lots of different ways, really creative ways, because we just want to show up. And then our home visitors go out and they work with parents. A lot of these families that we get to work with do not have a lot of adversity in their life. They have gone through a lot of difficult things, making their life really complex and difficult. And we show up for parents because a lot of them are coming to the table to say, I want better. I want to do better for my kids. And so we teach them skills. We model them skills. We do advocacy there, too. And so all across the agency, we are trauma-informed. We believe in empowering. And it's just a gift and an honor when people are in some of the most difficult circumstances of their life to be able to sit across from them and show up and journey through and help them find hope again.
And you're not just helping in a physical sense, you're in an emotional sense, probably is even more crucial in this case.
Absolutely. I think some of the physical things sometimes are quick and easy, and a lot of times people are kind of guarded behind those things, right? And when we start building rapport that way, and now we've helped them secure housing, they really start trusting the staff there, and all this pain comes out, right? And all the lies that they've been told about themselves, that they now believe, I'm not worth anything, it's my fault. All those things, we get to really start saying, no, that's not it. Here are all the things, and help them really figure that out and walk alongside them to do that. So I would say that hurdle for many is the most difficult, but the most powerful for sure.
So we have been reading stories since the middle of March, and when COVID came along and all of a sudden people were confined to their homes, that and those homes that were already prone to domestic violence were going to be even more prone to those kinds of things. Have you found that to be the case locally as well?
Absolutely. It was quite alarming when the stay-at-home order was in place because it was kind of silent. Our crisis line was incredibly silent, people seeking our services, the demand for our shelter, everything, right? And I think that's really complex for why I think that is. I think, one, it wasn't safe for many people to reach out because they didn't ever have space. No one was going to work. No one was going anywhere. They didn't get any separation away from the violence to call or to reach out. And so I think that was a huge factor. I also think because it was such an unknown, scary time, sometimes we have to choose between the bad and the worst. Mm-hmm. And I think that so many survivors were just saying, it's too risky to uproot my life right now.
Yeah,
I know this, I'm just going to stay. And I think, adrenaline kind of takes over, and we can buckle down short term, and we can do that. We're wired to do that as humans for lots of difficult circumstances.
Survival instinct.
Absolutely, yeah. But now we're noticing that this is a marathon, right? This is not a short-term thing, and we're seeing survivors reaching out. The lethality and the risk of harm to our survivors has increased dramatically. The complexity of the cases has increased. By the time they do reach out, there's been some really intense violence that's happened emotionally, physically, mentally, spiritually, all the things, right? It's really, they keep trying to hold on. I'm going to hold on. I'm going to hold on. I'm going to hold on. And they just can't. And so by the time they do reach out, it's incredibly intense, which puts some, we're limited right now too. And so it just keeps increasing the complexity, right? Our shelter capacity has had to decrease because we can't mix households in our shelter like we could have before. Mm-hmm. So, we have to have one. It could be a family of two in a 4-bedroom room in our place. And before we could fill those other 2 beds, but now we can't.
Right.
And so our capacity has had to decrease. We've had to find alternative solutions, which also pose other safety concerns, and they don't get nearly as much support. So it's just really tough. Mm-hmm. It's as if, leaving a violent relationship was, that was hard before, mm-hmm. and it's really difficult now.
Okay. So if somebody needs your services, how do they get a hold of you?
Absolutely. Our 24-hour crisis hotline is 775-7233. They can reach out 24 hours a day, anytime, and that's the first step to reaching us. And that would be the first place I would say to go, and then we can sort out what services are best for you and what you're looking for.
And again, to help the families you're assisting during the holidays, whether it be Thanksgiving side dishes or adopting a family for Christmas, how do folks help there?
Yes, call our administration building Monday through Friday at 9 a.m. to 4 p.m., and that is 775-7299, and we'll connect you.
And that's Amber Herlein, the Executive Director of Oasis Family Resource Center in Cadillac. We so much appreciate your time here on Cadillac Unscripted this morning, and thanks for all the great work you're doing in the community, Amber.
Thank you so much for having us. I appreciate it.
It is Cadillac Unscripted, sponsored by Independent Bank and Marianne Quist of RE/MAX Central. We'll do it again next week at 8:30 on 107.9 CDY.